we have a patient who is an elderly man who came with a subarachnoid hemorrhage, that is a very dangerous kind of bleed in the brain, and this has happened because of rupture of an intracranial aneurysm. Basically, the blood vessels in the brain have three different layers, but due to hypertension or any other cause, if the blood vessel becomes weak, then that swollen up and balloons and swellens up, and that is called an aneurysm. Because the aneurysm has a single layer, it has a propensity to bleed and rebleed. So here we are going to do a coiling of ACOM aneurysm, and we will show you the techniques. Like exercise 3. Roadmap here. Reset. You can stand with me here. You can come close to me. So we are trying to cannulate the aneurysm and communicating out. At the top. So we just moved into the A1 on the left, and slowly we are progressing. We have crossed into the other side, which is good and safe for to navigate our catheter here. A lot of trouble has been taken care of because of this, and now we will slowly try to move into the aneurysm here. Can I talk? So we have a coaxial system which is keeping us firm there. It's very important when we are doing ACOM or a MCA. Better you should have so we have tried. So we entered the aneurysm with a wire. Very carefully we will navigate our microcatheter inside. So we have some channels. Yeah. So we are through. Now our microcatheter is inside the aneurysm, and we will start coiling. 3, 6, 3.
Prashant, choose.
So we are choosing a 310 point here. So this is basically a detachable platinum coil, and 310 means it's about 3 millimeter in diameter and 10 centimeter length. We're just going to go inside the aneurysm and try to just put the coil inside. Going on that?
Hold on.
Yeah, that's good. 7 people are.
Okay.
So you can see the tip of the microcatheter right inside the aneurysm. As we push the coil, we will just pull it a little bit. We don't want to hit the dome with the coil. Saruk, I want the screen to be further closer to you. max mag you have? Go ma. Maximum magnification is it?
Magnification.
Zoom max, sir?
Yes, sir. Yes, sir.
So there can be variety of technique for coiling. It could be balloon assisted coiling, a stent assisted coiling, double stent, double balloon, and then we have intrasaccular and extrasaccular flow diversion. And just here we are doing a simple coil, which is the knee here. So as we go ahead with the coil, we will just try to pull the microcatheter a little bit so that we don't hit the dome with the coil, the tip of the coil, although they are very soft, but they can always rupture the aneurysm, which will be catastrophic. So now as I just go in, I will manipulate my catheter a little back, a little away from the dome, and then my coil comes out, and it will take a shape of that 3 millimeter. So looks like a longer coil, or it's just because it's a tortuous anatomy, so you can see the catheter being prolapsed to M1. So very gently. So here I would like to give little time so that the coil is well accommodated in the aneurysm. So it's a 10 centimeter coil, almost like 8 centimeter. We are inside the aneurysm. It looks well packed with this coil, and hopefully this is going to just occlude. Here we can do a check angiogram and see how things look like. So it looks much better. So we have little space inside the aneurysm. Hopefully we will be able to accommodate this, the remaining part of this aneurysm. Yeah, so you can see it here. So it looks quite good now. Roadmap on this. So we've taken a smart mask so that we can understand where it is. Okay, roadmap out. So now we know the outline of this aneurysm. So this is very tricky. You have to be really having a lot of patience, and so it's a gentle play of all your fingers. More. are the options we have? We just can wait a little bit and try to accommodate, or we can take a smaller coil. That is also an option. So 3/8 was our choice, but we didn't have, so it's a 3/10. We have a 3/8. We will see. If it goes just about a couple of centimeters, then it's done. If not, then we can change. Huh? See? Stop. Give it here. So it's allowing us millimeter by millimeter. So a little bit of patience and it's almost a centimeter left here. So in 5 minutes we will try this, otherwise we will change to a smaller length coil. So it's a little delicate system when you are playing with it, especially in ICOM or MC bifurcation, because the couple of branches which are very closely associated with this aneurysm can be tricky. So I might choose a smaller coil here, that would be more ideal. So I'm trying to take this coil out, and I will take a smaller one. So what's the next you have? Smaller one? 3/6?
Yes, sir.
Okay. So the most important thing when you are doing an aneurysm coiling is you should not be panic. You should be in total control of the situation, and if needed, you should change your strategy and see that a safe outcome is there. 3/6. Okay, we can start with 3/4 framing and then a 2/6 inside. Okay. 3/4 3D. After that, we can cut this coil half and we put same coil. That's our problem. Give it to me. So this coil here. So we are choosing a 3D 3 to 4 centimeter, and this will be a framing coil. Inside that, we can put another smaller one. Good. Go. Roadmap on this. So we take a start mask and we'll create roadmap on this. Let's start with 3, 4. So now we are just pushing the coil and this will exit from the catheter. So now as you see the coil is sitting there. Here we have chosen a 3-4 coil which is going inside the aneurysm. And as I said you should have your fingers working right there. And very gently you just have to place this coil. You see this? This will go inside. That's quite a good opacity. And you have a marker here. The marker has to cross the marker of the catheter. This is the coil marker, the straight one. And there is a proximal marker of the catheter. This 3 centimeter marker. There is a marker at the distal end of the picocatheter. There is one marker 3 centimeter behind it. And once your coil marker just crosses that line, here you can see in the fluoroscopy, then we are going to detach this coil this way. This is the detachment system and we will just press it. And this is detach it again. So we should have 3 beeps, ting, ting, ting. So we are not having 3 beeps here. Just check. Okay, so it's detached. So our coil is there and then we have detached the pusher. So this looks very good. Coil mask there. We'll do a check angiogram and see how the aneurysm looks like. Nice. So it's a beautiful framing coil, and we'll try to just accommodate 1 or 2 and here we are going with a 2x6 coil. Yeah. So we are going to go ahead with a 2x6 coil, and that should be the end of this procedure. We should be very beautifully able to place this coil into its aneurysm. So this is basically the aneurysm. This is the A1 on the left, A2 on the left and right, and this is the M1 MCA bifurcating into M2, couple of branches. There you go. A steady frame so that it will be even visually more open. Camera should be on a frame. But your hands are also very steady. Good. are going ahead with 2/6, the next coil. So again, the trick is go slow, go easy. There is no hurry. You have all the time in this one. Turn the bulb. So it's a 2/6 coil. So there is some issue here. We are trying to negotiate. We are trying to request the aneurysm to accommodate this coil, and hopefully we'll just give a little time. The whole idea is you should have a good packing density into the sac, and so this is looking beautiful. Yeah. So we have quite an angle with the so that is giving us a little trouble. So now you can see things are much in control. So the aneurysm is packed, the coil is inside the aneurysm, and everything looks okay. So maybe a millimeter ahead, and we can detach. This is just a check angiogram. This is beautiful. And what? Yeah, that's it. So I'll try to push that last millimeter of this coil so that it can be detached. So it looks okay. What do you think? You try to do that? Or try to push it a little bit. Can you switch up the light? Yeah. That's what we know. So these are the lights you can see on the detachment system. We expect some 3 beeps. So sometimes it just gives 1 beep. So in that case we have to detach it again. We would love beep, beep, beep. That shows that the coil is detached. Now we'll just check. Yeah, it's detached because the catheter is pushed. So this looks beautiful now, much better. So the idea is to stay always focused and relaxed and the atmosphere inside your operating area should be absolutely nice. And if you're good at jokes, that helps. So we have Sister Parvati, who is almost like more than 500 aneurysms she has assisted with me. We have completed over 1,000 intracranial aneurysm treatment as a team. So now this is detached. So this looks perfectly fine now. Just give me AP with full back. This looks like a solid coil mass which has replaced the ruptured intracranial anterocommunicating artery aneurysm. Wonderful. So we can see the aneurysm is excluded and the rest of things are looking perfectly fine. So go back to cranial 15. Give me the signal. Will just come out. Sure. Are you happy? Body. So we have body from striker. Body from striker is this person, and we have Dr. Arvind, who is a vascular medicine specialist. And we have Murli, who is doing so, and Gauri and Saruk. That's not the Saruk Khan and Gauri. It's different. And we have full anesthesia. So now we just take out this microcatheter. So the idea is just push your wire a little bit. Sometimes the microcatheter might be holding last part of the coil. So in that case, you just pull the microcatheter out, the coil might come out. So to be very carefully just pushing your wire a little bit. And once that is done, so you can do it. So now see my the micro wire has come, and I will gently go inside till the tip of the microcatheter and push it a little bit so that if anything is there, it goes away. And holding the wire there, I just gently pull the microcatheter. So like that, we just pull this whole thing out. So now your aneurysm is coiled, the whole system is drawn out. So we will do a final check angiogram to see how these aneurysms look like after the coiling. That's perfectly okay. This is a beautiful thing. Thank you. So this is how we do an aneurysm coiling, which is a routine procedure here. I'm Dr. Sivasankar Dalai, and my team includes Murli, Prasad, Bharati, and Suresh, Saruk, and Gauri. And here we have Arvind, Basant, and Prasant, who looks after the patient care well. And so thank you for giving your time and watching the video. Thank you very much. Of anesthesia. Thank you, Shweta.
Finish.
Thank you all. Yes.